So, good evening, guys. Can you hear me? So, if you are able to hear me, please mention in the comment. Hello, can you hear me? So, can you hear me, guys? So, please mention in the comment section of this video. Yeah. Thank you, guys. So, thank you, Rakesh, Adyashri, Shankar Gaud, Chandar. Okay, guys. So, we will wait for 2 more minutes and we can start our session. Okay. So, thanks for your confirmation once again. So which screen you will see now? Medical coding freshers most common interview Q&A. What do you see on the screen now? Please mention in the comment section. So please mention in the comment section. What do you see on the screen? So that I can understand. Okay, thank you. Thank you, Rajesh. So we will wait for only 1 more minute and we can start. Yeah, okay guys. So as based on our post, today we are going to learn medical coding pressure interview questions and answers. So as all of you know, we are having Fast Coder 21 medical coding YouTube channel. So currently we are having nearly 13,000 subscribers. So always my intention is to help the medical coders as much as possible. Okay. So as all of you know, nowadays there is a huge competition for medical coding, correct? So most of the people wants to join in medical coding, but they don't know what are the most appropriate Q&A for fresher medical coding interviews. So in this session, I am going to tell you few scenarios. Mostly they will ask in the interviews. So I will not tell that these are the things you are going to encounter in the interviews, but mostly you will encounter these type of interview questions. So just you need to understand that these are the basics for medical coding field. Okay. So first, what is medical coding? So can you hear me, guys? So medical coding is the process of translating healthcare diagnoses, procedures, medical services, and equipment into standardized alphanumeric codes. So these codes are used for billing, insurance claims, and health data management. Okay. So what is medical coding? So medical coding is the process of translation of diagnosis, procedures, and medical services. Okay. So and using alphanumeric codes, we will convert or translate these diagnosis procedures into alphanumeric codes. Most of the time, we will use these codes for billing, insurance claims, and health data management. Okay. So this is the most important interview question for fresher jobs. Why means whenever you want to go for medical coding interview, you need to understand what is medical coding, correct? So this is the most appropriate question for you. Okay. Next, what are the code sets used in the medical coding? Okay. So in medical coding, we will use three types of code sets. Okay. So first one is ICD-10 CM. So basically the basis of ICD-10 CM is the ICD or International Classification of Diseases from World Health Organization. Okay. From there, every country they will convert that data into their appropriate codes. So currently in India we are using ICD-10 CM and mostly we will work for United States. Okay. So ICD-10 CM means, so if you go to interview they may ask you what is CM. So anyone knows, guys, CM? What is CM? So ICD-10 CM. So don't worry, here CM is clinical modification. ICD-10 CM is ICD-10 clinical modification. Mostly we will use ICD-10 CM for diagnosis. Like for example, we are having the appendicitis. So patient is having the appendicitis. This is the condition or diagnosis. For that time, we will use ICD-10 CM. Okay. Next one is CPT for procedures and services. Okay. So what is a procedure? So the procedure is a definitive treatment in order to rectify the patient's problem. Okay. For example, patient is having the appendicitis. Correct. Where we have coded the diagnosis using the ICD-10 CM. Okay. So patient came in for appendectomy. So that time we will use CPT codes. Okay. So these are for procedures. For example, if the physician performs appendectomy. So appendectomy is the procedure. So using CPT, we will code appendectomy procedure. In ICD-10 CM, we are having ICD-10 PCS also. Okay. So mostly we will use ICD-10 PCS for inpatient coding. Okay. So for inpatient coding, we will use ICD-10 PCM and ICD-10 PCS. For outpatient coding, we'll use ICD-10 CM and CPT. Okay. Next one is HCPCS, Healthcare Common Procedural Coding System for Medicare and Medicaid and includes codes for supplies and ambulance services. Okay. So here these are the differences between types of code sets usually we will use in the medical coding. So inpatient coding will use ICD-10 CM as well as ICD-10 PCS. So PCS means procedural coding system which we will use for inpatient coding. Okay. In outpatient coding, we will use for diagnosis, we will use ICD-10 CM. For procedures, we will use CPT. Okay. And HCPCS also will use in the like outpatient coding only. In inpatient coding, you will not use HCPCS. Okay. In outpatient coding, you will use ICD-10 CM, CPT as well as HCPCS. Okay. Next, why medical coding is important? Okay. So why important? So billing and reimbursement purpose. So which includes or ensures doctors and hospitals are paid properly by insurance companies. Okay. Next, patient records keeps accurate and standardized health records. Okay. So data analysis helps research, public health tracking and policy making. And legal production, accurate coding helps avoid fraud and legal issues. So these are the benefits of medical coding. So if you go to interview, they may ask you, what is medical coding? and what are the code sets in the medical coding and why medical coding is important. So you need to understand what is the purpose of medical coding. So then only you can join in any type of company. Okay. So any doubt guys here? Rakesh, Chandar. So any doubt you can let me know in the chat box. Okay. So next we need to understand what do you understand by DRG. Okay. So basically DRG means diagnosis related groups. Mostly we will use DRGs in inpatient medical coding. Okay. So in inpatient medical coding we will use DRGs. So if you go to interview they will ask you what do you know about DRG. So you need to tell them in inpatient coding for PDX and secondary diagnosis we will get one value. Okay. So that is the DRG value. Okay. So just you need to remember here DRG is applicable for inpatient coding. So what is the difference between ICD-10 CM and ICD-10 PCS? So as we have discussed previously, ICD-10 CM is for inpatient medical coding diagnosis coding. ICD-10 PCS is inpatient medical coding procedural coding. Okay. So then they will ask you what is the purpose of CPT then. So you need to tell them the purpose of CPT is to code procedures in the outpatient setting. Okay. So that is the meaning of this one. Okay. So how do you select the correct diagnosis code from a medical report? Okay. So whenever patient comes to physician, we need to check the diagnosis first. Okay. Most of the time your diagnosis or PDX will be available in the assessment plan. Okay. So always we need to code principal diagnosis or primary diagnosis from the assessment and plan, and also we need to check what is the major reason for patient encounter and what type of treatment patient was received by the physician. So based on that you need to code the correct diagnosis. Okay. Next, what is upcoding and what is downcoding? Okay. So basically upcoding means, so if the physician performs, for example if you take uh, in CPT we are having two codes like hysterectomy codes. So one code consists of only hysterectomy. One code consists of hysterectomy plus salpingo-oophorectomy. Okay. Upcoding means, for example, if the operative report contains hysterectomy, you need to code hysterectomy code only. You can't code combination code of hysterectomy plus removal of the tubes. So that one you will call it as upcoding. So then downcoding. For example, in second scenario, physician has performed the hysterectomy plus removal of fallopian tubes and ovaries. So that time you need to code combination code of hysterectomy plus removal of tubes and ovaries. You can't code only hysterectomy coding. Okay. So that is the procedure of upcoding and downcoding. So upcoding means you need to code whatever the physician has performed. Okay. So downcoding means you can't downcode the procedure performed in the operative reports or documentation. So just try to remember hysterectomy example. Okay. So any doubt guys here? Any doubt? Okay. So if you like this session, please click on like button so that YouTube will send this session to most of the people. Okay. Yeah, please. So next, can you walk me through the coding steps for an outpatient chart? Okay. So they are asking, or in the interview they may ask you, what are the steps to code an outpatient chart? Okay. For example, if you take, you can take any one chart for your explanation. For example, we will take operative reports or surgery coding. Okay. So what happens in surgery coding? Whenever you will receive the chart, you need to check the first pathology report. So you need to understand what is the reason for or what is the final diagnosis. So why means based on pathology report, we need to code it as PDX most of the time. Next, we need to check the operative report. So we need to check whether we are having operative report or not. So why means sometimes if you don't have correct to operative notes, okay, so we don't have operative notes na, so we need to code or we need to send the query to the physician. Okay, so that is the thing. So next we need to code for the secondary diagnosis or chronic conditions. Okay, first we will check pathology report. Next we will check operative report. So why means if you don't have these two reports, we need to send query to the physician. Okay, for example, if you are having both pathology and operative report, directly we can code them, and along with that we need to code the chronic conditions. Okay, so that is the criteria for outpatient chart. Okay, so one more is, how would you code for patient with diabetes and hypertension? Okay, so for diabetes and hypertension we are having one combination code E11.59. So diabetes with other specified circulatory system diagnosis or condition. Okay, just remember E11.59. Okay, next, how do you handle discrepancies in a medical chart? So what do you do? So if you find any discrepancies, means conflicts in a medical chart, what do you do? So mostly it is, we are a fresher, we need to ask our seniors or our team leader. Okay, so how can I code the chart as there is a discrepancy in this chart? So we need to take assistance from our seniors or team leader. Okay, so what would you do if you are unsure about a code? For example, you have coded one diagnosis, but you are not unsure about that. So for that you need to check the resources. For ICD-10 CM we are having ICD-10 CM coding clinics. So that is the official guidance we need to use for our day by day medical coding. So you need to use that references. Otherwise, you need to follow your client guidelines. Okay. Next one, how do you ensure accuracy while coding high volume workload? So just based on, so whenever you are having the high volume workload, and how do you ensure accuracy? So whenever you want to code, you need to check main resources of medical coding. So in medical coding, we are having multiple resources. For ICD-10 CM, we will use ICD-10 CM coding clinic. For CPT, we will use CPT assistant as well as HICPICS coding clinics. For IVR, like interventional radiology, we will use Dr. G's interventional radiology book. So before coding any type of chart, first you need to ensure your like references are available along with you. Then only you need to start your coding process. Okay. And next one is, are you comfortable working in shifts and repetitive tasks? So it is, so based on your comfortability, you need to answer this question. Okay, next, how do you manage stress and deadlines? Okay, just this is personal question, so you need to think about this one and you need to answer. So what do you do if you are in stress, and how do you reach your deadlines? Okay, next, describe the time you worked in a team to complete a project. So anyway, you will, they will not ask you this one. Why means we are going for a pressure job, you don't need to worry about that question. Okay, so next, where do you see yourself in 3 to 5 years in this field? So as obviously everyone wants to gain knowledge and improve ourselves. So just tell them, I want to, first of all I would like to learn medical coding appropriately, then I will see based on my knowledge I will try for appropriate suitable jobs. Okay, next, what do you know about our company and its services? So whenever you go to any type of interview, for example, if you are going for Omega, okay, so before going to that interview, you need to check Omega website. Okay, why means if you observe or if you check the Omega website, they can understand that you are vigorously interested to join with Omega. So they think that you are enthusiastic to join in Omega. So it will give you plus points to you. So always, whenever you go to any company, check their website first. Okay, next, are you willing to relocate or work from the office? So this is based on your situation, you need to answer this question. Okay, so next they will ask you, what are the diabetes mellitus types? Okay, so we are having gestational diabetes. During the pregnancy only we will see gestational diabetes. Next is juvenile diabetes. Otherwise, we will call it as type 1 diabetes. This is insulin dependent. So along with type 1 diabetes, we will not code any type of long term use of medications. Next one, adult diabetes, which is type 2, insulin resistance. Okay. So most of the time, so the default for diabetes, for example, you are having the documentation, but they did not mention whether it is type 1 or type 2. So what do you code, guys? Anyone knows? So write it in the chat. So anyone knows what is the default diabetes code? Type 2 or type 1? Yeah, perfect. So type 1 is the default code for diabetes if the documentation does not contain type of diabetes. Okay. Just here the most importantly, along with type 1 diabetes, we will not code long term use of medications. Okay. Along with type 2, we will use long term use of medications. So just you need to remember this one. Okay. Next, what is hypertension? So obviously, high blood pressure, other name is hypertension. Okay. So next, what are the vertebral types or vertebral segments? Okay. So we are having like cervical, thoracic, lumbar, sacrum, and coccyx. Okay. Cervical is having 7 vertebrae. Okay. Thoracic spine consists of 12 vertebrae. Lumbar spine consists of 5 vertebrae. Sacrum consists of 5. 5 vertebrae, but they are fused. Okay. Coccyx consists of 4 vertebrae, but they are also fused. Okay. So this is very very important for interviews. So mostly these all are very very important, guys. Okay. So cervical 7 vertebrae, thoracic 12, lumbar 5, sacrum 5 fused, coccyx 4 fused. Okay. Next, emergency condition. So basically they will ask you what is the emergency condition. Okay. So emergency is a condition where patient needs immediate medical treatment. Otherwise, it will become immediate medical threat to the patient's life. Examples are heart attack and stroke. Okay. So whenever you see heart attack or stroke, you need to remember that this is a immediate medical threat and you will consider it as a emergency medical condition. Okay. So next one is acute and chronic. So what is acute? So if you go to interview, they will ask you what is acute condition and what is chronic condition. Okay. So acute conditions are sudden and short term. They will come suddenly. Chronic conditions are long lasting. So again they will ask you, tell me few acute conditions and few chronic conditions. Okay. For example, they will ask you few acute conditions. For example, patient is having the injury and patient had what do you call fracture. Okay. So fracture is a acute condition. Next, chronic conditions like long lasting, like hypertension, diabetes, osteoporosis, osteoarthritis. These all are chronic conditions. Okay. Next, they will ask you what is the difference between IP and OP. Okay. So IP means inpatient, OP means outpatient. In the inpatient coding, patient will be admitted to the hospital. Okay. Here patient will stay more than 24 hours in inpatient coding. Okay. So in outpatient coding, patient will be not admitted. Okay. So within or less than 24 hours is outpatient coding. Okay. So few examples for outpatient coding is E&M, emergency department, and surgery coding, as well as pain management. So all those things comes under outpatient coding. Okay. So next one is what is the smallest bone? So stapes. So which is in the ear. Okay. So what is the longest bone? Okay. So femur is the longest bone in the human body. So where do you find femur, guys? Upper leg or lower leg? Yeah. Thank you, Rakesh. So where do you find this femur? Anyone? Yeah. No, lower leg. So why means yeah, upper leg. Sorry. So femur is in the upper leg and remaining two bones in the lower leg. So upper leg is the correct answer. Okay. Next, what are the heart chambers? So we are having right atrium, right ventricle, and left atrium and left ventricle. Okay. Next, what are the body systems? Okay, one example. So they will ask you, so do you know body systems? Yes, I know. So tell me one example. So to just tell them respiratory system is the example. Okay. So what happens during the respiratory? So oxygen will be intake and CO2 out. And respiratory system consists of includes lung and trachea. Okay. So oxygen will be absorbed in the lungs and CO2 will be discharged outside. So that is the process of respiratory system. Okay. Next, GI tract sequence. Okay. So our GI tract consists of two parts: upper GI tract and lower GI tract. Okay. So upper GI tract starts from mouth to duodenum. Okay. So lower GI tract starts from anus to cecum. Okay. So this is the process. So starts with mouth, pharynx, esophagus, stomach, small intestine. So these body parts are related to lower intestine or lower GI tract or lower bowel. So large intestine consists of anus, rectum, sigmoid colon, transverse colon, and ascending colon and cecum. So just you need to remember GI tract consists of two parts: upper GI tract and lower GI tract. Okay. So what is the heaviest organ? So liver is the heaviest organs in the body. So bile will be produced by liver. Okay. So where is bile stored? So bile stored in the gallbladder. Okay. So organ, both exocrine and endocrine. So which will act as a both endocrine and exocrine organ or gland? Pancreas. Okay. So insulin secreted from beta cells of pancreas. Okay. So basically these are very basic questions. So if you are going for fresher interview, they may ask you all these things. Okay. Next, why children have more bones? Okay. So why means bone fuse as they grow. Okay. So total number of bones in adults. So 206. Okay. Next, antigen antibody reaction. So what is antigen and antibody reaction? So antigen to antibody reaction is immune response to foreign substances. Okay. Next, immunodeficiency. So what is immunodeficiency basically? So weak immune system. Most of the time the patient most of the time patient will get HIV due to weak immune system. So that is the definition of immunodeficiency. HIV and AIDS. Virus destroys immune cells, CD4 T cells. So patients will get most of the time due to destruction of immune cells in the human body. Okay. Next one is what is angina? So angina is chest pain due to reduced blood to heart. So if there is reduced blood supply to the heart, patient will get angina or chest pain. Other name for angina is chest pain. Okay. So next they may ask you what are the types of nervous system. So we are having two types of nervous system. Okay. So central nervous system, peripheral nervous system. Okay. Next, what is anatomy versus physiology, or otherwise what is anatomy and physiology? Okay. Anatomy means using the anatomy we will learn the structure of the human body. Okay. Using the physiology we will learn what is the function of each human body structure, and we will learn how to interrelate these structures in order to perform complicated human functions. Okay. So basically anatomy means structure of the human body, physiology the function of the human body. Okay. Next, what are phalanges? Okay. So you will see phalanges in the fingers and toes. So just you can tell them bones in the finger and toes called as phalanges. Okay. Next, what are the types of joints? So ball and socket joint, hinge joint, pivot joint, gliding, and saddle joint. Okay. Next, what is itis? So basically, itis means which is a suffix, okay, in medical terminology meaning inflammation, arthritis, bronchitis. Arthritis means itis means inflammation. Arthro means joint, okay. So basically, inflammation of the joint is called as arthritis, okay. So what is the normal BP reading? So normal BP reading is 128 by 80. So 120 systolic and like 80 diastolic. Okay. So how do we measure BP? Okay. So in order to measure the BP, we will use sphygmomanometer plus stethoscope. Okay. Next, what is asthma? So a chronic inflammatory disease of the airways causing wheezing, shortness of breath, and cough. So due to bronchospasm and mucus production. So what is COPD? So a progressive lung disease includes chronic bronchitis and emphysema causing difficulty breathing, often due to smoking. Okay, most of the time we will get this COPD due to smoking. So in order to away from this COPD, we need to stop smoking. Why means if you go to interview, they will ask you what is the difference between asthma and COPD. Just you need to remember this wording. Okay, so asthma is the airway disease. Okay, so the COPD is the lung disease. Okay, next, what is a cleft palate? So a birth defect where there is a split in the roof of the mouth affecting eating and speech. Okay, next, so ductus arteriosus. So what is ductus arteriosus? So ductus arteriosus is the a fetal blood vessel connecting the pulmonary artery to the aorta bypassing the lungs. Should close after birth. If not, it is called patent ductus arteriosus. Okay, so that is the definition of ductus arteriosus. Next, they may ask you what is the difference between artery and vein. Okay, artery carry oxygenated blood, vein carry deoxygenated blood. Okay, so next they may ask you what is the difference between pulmonary artery and pulmonary vein. Okay, so pulmonary artery carries deoxygenated blood from heart to lungs. In the human body, only one artery which will transport deoxygenated blood is pulmonary artery. Okay, so which will transfer blood from heart to lungs. So next one is what is pulmonary vein? So which one? So here this pulmonary vein takes oxygenated blood from lungs to heart. Okay, next is what is SA node? Otherwise we will call it as natural pacemaker. So sinusoidal node in the right atrium generates electrical impulses to regulate heartbeat. Okay, so next one is what is CPR? So CPR means cardiopulmonary resuscitation. So which is a emergency procedure for cardiac arrest. So where patient will perform chest compressions plus rescue breath to maintain blood flow. Okay, so that is the meaning of this CPR. Okay, so okay guys, so I am concluding this session here. Next week we will see few more questions related to freshers medical coding interviews. Okay, so do you have any doubt? Just we will stay for 2 minutes. We can write in the chat box. Okay, so are you able to understand? Okay, so if you are looking for medical coding jobs in UAE, India, or USA, please join in our WhatsApp group link, which is in the description of this video. Okay, and also if you are looking for any trainings like same day surgery coding training, IPDRG, HCC, CCET training, please send WhatsApp message to 707-526-3939. Okay, so okay guys, so if you like this session, please click on like button. So next week we will see few more Q&A related to freshers interview questions. Okay, so thank you guys. Thanks for your time. I am concluding this session here.